joining us today. I just want to take a couple of minutes to thank the many essential workers who have really been in crisis mode since January. First and foremost among those, all the medical workers who have really been working tirelessly to keep everyone safe and healthy as possible and to care for those that are sick and who have come down with COVID-19. They've done really an amazing job under very difficult conditions, very stressful and dangerous circumstances. Unfortunately, that's going to continue for some time into the foreseeable future, but just wanted to do a shout out and great heartfelt thanks to all of them. And also wanted to mention many others that don't receive quite as much attention, but have continued to take care of essential work. In particular, those who have been staffing our emergency coordination center in Everett. We've got our first responders, the medical examiner's office, been extremely busy, corrections staff, solid waste professionals, park staff, human services professionals delivering services out to the public. Public works, our road crews had to transition very quickly to keep working socially distanced, but our road crews have been out there every day. Planning and developmental services, the IT department, which is holding it all together, providing technological services, computer services, and helped us make that shift to remote work and communication. The courts system, which is up and running again, facilities and fleet, prosecuting attorney's office, the assessor's office, treasurer's office, auditor's office. We're in the middle of an election and they're functioning well. Clerk's office and many, many others. So we don't think about those folks very often, but they've been working hard and been doing an amazing job. And we did make that transition to remote learning. We asked our staff and all our partners to really create protocols to be safe, keep themselves and their families and public safe, and ask them to work remotely. And we did that really in just a few short weeks. We changed how we did business. We've actually improved our efficiency in some cases measurably, and we're very proud of being able to do that so quickly and seamlessly. So I'm just really proud of all the workers in public and private sectors who have taken the challenge of taking care of business during the pandemic and working to keep people safe and healthy, and they should all be applauded. So later today, we'll be making an announcement with our regional partners that Snohomish County will be extending remote working until the end of the year. So we're going to continue to work remotely. It's working well. Some essential workers and folks that need to be on campus will be, but we'll assess the circumstances as we go and make changes as necessary to keep everybody safe and healthy as possible. We also know that many parents are anxious about school starting without in-classroom instruction, so we just wanted to remove any anxiety and assist people in making plans. So again, Snohomish County will continue teleworking and remote working policies. So we'll continue to insist that all our public servants continue to fulfill their duties while ensuring social distancing measures will work. And I just wanted to assure you that county government is working well. I'm extremely proud of everybody and thank them for making that shift. So unfortunately, we've seen a troubling rise in cases. We just need everybody to understand that we're in this for the long haul. And the only way to beat back the COVID is to wear masks, maintain social distancing, don't travel, avoid congregations and groups of people. So with that, I'll turn it over to Dr. Spitters of the Snohomish County Health District.
Thank you, Executive Summers, and good morning, everyone. First, I'd like to give you an update on the numbers that Executive Summers referred to. This rolling 2-week average that we calculate, every week we recalculate the number of newly reported confirmed cases in the prior 2 weeks divided by 100,000, and then that gives us a metric to compare ourselves across time and with other regions in the state and country. So we've now had our 6th consecutive week of a rising result from that, and this past 2-week period, we're up to 97.2 cases per 100,000 for that 2-week period. And that puts us right about even with where things were in mid-March. And I think you'll remember that. It's a slightly different group that's affected now. That, as I've mentioned previously, that was an older group with a lot of involvement of elder care facilities. This time around, folks over 70 are only right now about 5% of the affected population. They are the group at most risk of severe disease and hospitalization, and protecting against that hospitalization and overrunning the hospital system, of course, is one of our key objectives in the COVID-19 response. But right now, most of the disease, 55% of it is in individuals 15 to 39 years of age. We are seeing hospitalizations statewide in that group increase. It's much lower than we see in the older age groups. Severity is less, but still, even young people can develop severe illness, hospitalization, or complications. The other thing I wanted to mention is our testing. There were about 5,000 tests done in Snohomish County last week. That continues to increase over the past month or so as demand for testing increases, as well as the health district's efforts to increase the drive-through testing, which we're currently running at about 1,000 tests per week that we've added essentially to the county-wide mix over the past month or so. So I think that just speaks quantitatively to that general notion that Executive Summers raised, that we continue to see rising numbers of cases, disturbing trend there. Nationally and statewide, we are seeing the cases move out of that younger age group into the older age groups. That's certainly been the course of the epidemic in some of the more severely affected states. So we remain vigilant and trying to keep an eye on that. Right now, our hospitalizations seem relatively stable countywide in the low 20s for COVID-related hospitalizations. And I imagine Dr. Sachdeva will have more for us on that from the local hospital perspective. Moving on to some highlights from the Safe Start guidance from the Governor and Secretary of Health. You'll recall last Thursday that Governor Inslee and Secretary Weissman announced some updates to the state Safe Start requirements. Starting Thursday, July 30, day after tomorrow, restaurants and bars must limit the number of people at each table to no more than 5, and they all must be from the same household. No mixing households in restaurants. This is true for both phase 2 and phase 3, which we are not yet in. Remember that we are phase 2, and given these numbers, I think there's no imminent plans to apply, much less be approved for any movement forward there. Restaurants are also limited to 50% capacity for on-site dining, and they must close gaming in social areas like pool tables or dartboards. Restaurants also must stop serving alcohol at 10 p.m. Bars are closed. The bar service in a restaurant, it should be closed up. Outdoor service is allowed with proper social distancing. Weddings and funerals have new guidance too. Starting August 6th, ceremonies are allowed with occupancy limited to just 20% of the venue's maximum capacity or 30 people total, whichever is less. That includes outdoor weddings as well. Physical distancing of 6 feet must be maintained between non-household members, and receptions are prohibited under the new guidance. Fitness centers and gyms in phase 2 are limited to no more than 5 people on site, not including staff, at any one time. This includes indoor pools, ice rinks, volleyball, and tennis courts. Phase 2 does allow for small group instruction or private training, but not general admission at a gym. Indoor entertainment and recreation centers like mini golf, bowling, arcades, and indoor card rooms are prohibited from opening at the current time. Regarding face coverings, Secretary Weissman also announced extension of the statewide face covering order to include all common areas, both public and private. This includes elevators, hallways, and shared spaces in apartment buildings, hotels, university housing, and congregate living settings like nursing homes. If you're not sure whether you should be wearing a face mask in a certain setting, just wear one. When in doubt, keep one with you so that you can wear one if you don't have it on and you see signals that others are wearing them or that there are instructions to do so. If you're going outside where you can keep distance, great. You don't need to wear a mask, but still wear one in case you find that there are more people around than you expected and you can't maintain a social distancing. My footnote on that is if you go somewhere, like we've had many photographs of natural recreation areas in the county sent to us with large, dozens and dozens of people standing shoulder to shoulder with no face coverings. If you encounter a place like that, or you get to a park or a recreation spot and there's no parking, that's a signal. Go somewhere else or go back home. Good news about contact tracing. The Health District has hired 50 contact tracers with support from the CARES Act funding. That's the federal funding money to help us all survive through this event. All of our new contact tracers are now set up, trained, ready to work. We do want to remind people that in order for them to do their job and achieve the function of containing and suppressing transmission, we need people to answer their phones and respond to text messages when they receive them. They will have important information and instructions if you have tested positive or have been exposed to COVID-19, and they may need information from you to help notify others who are potentially exposed. Keep in mind, a contact tracer will never ask you for your social security number, immigration status, bank account number, financial information, or other like information. If someone claiming to be a contact tracer asks for any kind of information like that or a payment, you know you've got a scammer on the phone and hang up. Just a quick note on testing. The Health District is continuing to coordinate drive-through testing, as I mentioned earlier. We are moving locations starting Monday, August 3. We have been testing at McCollum Park for several weeks, but we will be moving back to the testing site we originally occupied on Broadway near the Memorial Stadium and the Everett School District. This is actually the Everett School District building parking lot. This is the same location we first opened, as I mentioned, back in March. We're moving to this location because the setup there is just more amenable to what we're trying to do and should allow us to reach our target of 500 people a day, as opposed to the maximum of about 250 a day that we're able to do at McCollum Park. The new location and testing times for next week will be available later this week on our drive-through testing page. And so those are the updates I have for you today. We've received a number of questions about hospitalization rates. I've mentioned the county-wide picture that we continue to track. Just reminding you that the continued increase in COVID-19 is concerning as we anticipate that it may move into older age groups and increase severe illness and the need for a hospitalization. Toward that end, we are pleased to be joined today by Dr. Sachdeva from Swedish Edmonds and Mill Creek. He's the Chief Medical Officer there. Dr. Sachdeva, thank you for all you and your team have done from the beginning in terms of providing care to patients, coordinating your efforts with the other members of the healthcare system and with the Health District. So thank you for that. Thank you for joining us. And with that, I'd like to turn it over to you.
Thank you, Chris, and thank you, Executive Summers. Appreciate the invitation. Swedish Edmonds has been a huge part of this community since 1964. We've been serving this community. The Swedish mission is to improve the health and well-being of each person we serve, and we take that to heart. Since the start of this public health emergency, we have played our part. When I look back with pride, just to share some numbers with you, you talked about hospitalizations. To date, we have had 205 unique individuals who've been hospitalized at Swedish Edmonds. Our ICU, the percentage that went to the ICU was 17%. Our overall mortality rate was 21%. When I say the mortality rate, I just want to clarify this is the number of patients admitted to the hospital with COVID-19 as the denominator, and then the numerator is the mortalities related to COVID-19. When I also look at the numbers by month, I see a declining mortality rate. So the overall mortality rate is 21%, but for the month of June, a mortality rate drops to 7%. And I believe there are a few reasons for that. I think we've gotten better over time. We have learned about this disease, how to manage this disease. We've literally been sort of building the plane and improving the plane as we fly it. I'm super proud of the fact that Swedish, along with Providence, has been a national force behind some of the improvements that have happened in the care of COVID patients. We started the remdesivir trial, contributed the most number of patients who were recruited in our country for this trial as just one of the examples of the research we started to do, looking at ways to improve the care. There were other efforts, research efforts as part of Swedish and Providence, and that all has culminated in improving care and decreasing mortality. Suffice to say, patients coming in with COVID, especially if you have comorbidities, they're staying in the hospital for quite a long time, longer than an average length of stay. So the resource utilization has been much higher for these patients. But again, happy that we were able to take care of the folks who came here, and very proud of the fact that we have over time done a much better job in looking after these patients and transitioning them safely back to the community. Our focus right from the get-go has been on what we call the 3S of emergency preparation: staff, space, and stuff. And that focus continues to date, making sure that we have the staff. We've had to improvise during the surge. Fortunately, because of all the public health measures that were taken, we were not in a situation similar to New York City or currently what we see in Texas and Arizona and Florida, some parts of those states. So we avoided a catastrophic situation, again, thanks to all the measures that we took as a state and as a county. So I really appreciate the strong partnership with our county officials. The fact is that we are not out of this crisis, as the numbers bear out. And what I've been telling our caregivers is that each one of them is an ambassador for public health. We all have influence in the community that we live in, and making sure that we continue to influence our community members, encouraging them to wear masks, to adhere to all the public health guidelines around social distancing, hand hygiene, and other universal precautions. That is the most important intervention that we have at our disposal. And if we get to a 95% compliance in our community and our state, I can guarantee that within a few weeks, we'll be not only stabilizing the numbers, but bending the curve way down, and we can do it. And that's the message I continue to give to our caregivers, to be that force within our community to help propagate this. Our success has also been in keeping our staff safe. Like I mentioned, if we don't have the staff, we don't have a hospital. And so right from the get-go, we've focused on the safety of our staff. Very proud to share that in the ICU, where we've, during the peak of this crisis, we've had significant numbers of COVID patients. None of our ICU staff contracted COVID as a result of that. We were fastidious in making sure that our staff had the PPE and they were donning and doffing appropriately. In fact, we had monitors to monitor the staff while taking care of patients who had COVID. And that focus continues. And I think even before the county and the state mandated universal masking at the hospital within Swedish, we mandated universal masking, and that has been an unqualified success. Now, the few cases that we see within healthcare workers with positive COVID, we do a very diligent contact tracing. And invariably, the result of that contact tracing is that these healthcare workers got COVID because of activities within the community and not within the hospital. I think this just goes to show again the effectiveness of universal masking. So when I walk in the hospital in the corridor, I wear a mask. And we ask everybody coming into the facility to do the same. And in fact, we've been doing audits and very proud to say that recent audit of the medical staff, the physicians, revealed 100% compliance with masking within the hospital. The only time we take our mask off is when we eat or drink. And so this is again, for the members of the community, it works. I do also want to call out the close partnership collaboration. Every crisis has silver linings. This one has its share of silver linings, and that has been the collaboration with the county and local collaboration with other healthcare leaders. And so, I'm sure Chris can speak to that. We've been meeting, I believe, every other week, twice a month. This is other chief medical officers and Dr. Spitters, and having a really fruitful conversation about what's working, what's not working, sharing information, and that sharing of information has been just tremendous. And it's really helped all of us. Just to give you an example, at Swedish Edmonds, we started a study or trial to see if proning, in other words, helping patients lie on their chest and stomach. These are patients who are not on the ventilators. If COVID positive patients, if they spent a certain amount of time lying on their stomach, would that help them in their recovery? And so that study showed that yes, if you turn patients over and help them breathe while on their stomach and chest, it led to improvements. We shared that with Providence Everett, and sure enough, they took it up and ran with it. So these are the kind of examples of sharing information benefiting everyone. Lastly, the focus, again, going back to the staff, is recognizing that this is a marathon, not a sprint. We are not out of this crisis or public health emergency, and at times it seems difficult to see the light at the end of the tunnel, but we know that it's there. We are working towards that. And so with that in mind, I think Executive Summers had referred to the wellness and the stress on the staff. So right from the get-go in March, we recognized that we really need to focus on the wellness, not just the safety aspect of our staff, but the wellness. Because that then contributes to the resilience. We don't want our staff to be feeling exhausted. And so we stood up a wellness website within Swedish in March, basically collating all the resources that we had dedicated towards wellness. And also we realized once we did that and spread the word around wellness, there were teams within Swedish that were wanting to participate, wanting to contribute in whatever way they could towards the whole concept of wellness. So this website to this date has had 15,000 hits internally with close to 3,000 unique visits. So people are using this wellness website. Another example of wellness, making sure that we had a behavioral health concierge service that had been stood up, and through this service we provide 10 absolutely free, absolutely confidential counseling services through a clinical psychologist to all our healthcare workers and medical staff, irrespective of how you're employed. Whether you're employed by another organization coming to Swedish to work, but if you're coming to Swedish to work and you have any reason to feel anxious, any other mental health behavioral concern, it could be the healthcare worker, it could be something going on in the family, you're having trouble with your teenager or in your relationship. All you need to do is just call this confidential line and you will get 10 free counseling visits and then further guidance on how to deal with it in a professional manner. So we did notice an uptick in use of the behavioral health concierge service, which I was so proud that we had that, because then we were making sure that our healthcare workers were needing the help at the time at the time of most need. We had mindfulness classes, we did town halls, we did other focus groups where people could just come virtually and share their experience. A mindfulness challenge has been a big hit as well. So many such examples of wellness, and the focus continues on bottom line is we're trying to make sure that we stay connected. It is through these meaningful connections that we want to display, to show to each other that we are there, that I have my set of wing persons and I'm a wing person for someone else, making sure that that connection deepens and is our bedrock for looking after our community members. So I will stop there and would certainly entertain questions.
Thank you, Doctor, and thanks to you and all those you work with. Please express and pass on our heartfelt thanks to everybody. We know conditions are difficult, and just kudos to you. Thank you. We'll get through as many of these as we can. The first one was, what date was the county employee when did they begin teleworking? We announced our teleworking policy on March 17th. And began the transition immediately. Again, many of our folks have been working remotely. We've equipped them to do so. They're doing so successfully. Many others have had to be in the workplace, and we thank them too and know the special risks and strains that presents. So thank you. In terms of caseloads, caseloads at Swedish for 15 to 39 age group and 40 to 60, and what complications are those patients showing?
So at Swedish, just looking at the overall data since the start of the public health emergency, about 20% of our patients have been less than 50 years of age. So, you know, another spin-off of the crisis had been our data capability. Like most organizations, we scrambled to make sure that we had real-time data. And one of the things that Providence did was extensive analytics, and I'm just have that site open, and I'm referring to that site as I give you these numbers. So less than 50 years of age, 20%, and we did see patients without any significant comorbidities get admitted to the hospitals as young as 20 years of age who got significantly ill. And some of them initially died as well. So again, just as we see a spike of positive cases in the younger age group, I just wanted to share that this disease presents with a wide spectrum of symptoms, from being asymptomatic to minimally symptomatic to getting horribly sick. And you don't have to have comorbidities to get horribly sick. Sometimes the immune system, and we don't know why in some individuals, just responds so briskly that it starts to attack the healthy tissues as well. And so just cautioning our community members that this disease, while the preponderance of folks who get it are mildly ill, it's still a Russian roulette who gets deathly ill, you know. And so just the best thing is, you know, make sure we prevent ourselves from getting this disease.
Thank you. I think this one's probably for Dr. Spitters, but the Department of Health epidemiological 7-day running averages for cases at time of illness, hospitalizations, and deaths are plateauing and curving down. And Dr. Kathy Wasserman said she is guardedly optimistic. And how does this correspond to what's happening in Snohomish County?
Yes, that is the case statewide, and it's just important to always remember that means the statewide picture is the aggregation of a constellation of outbreaks throughout the state. And so the good news is, for instance, Yakima County, which was really in duress and is still struggling, but they're now on the downside of the peak, and that's in part driving this because they had such high numbers. But Snohomish County, things are still headed up, and you know, we have 6 months of experience with this virus, 2 waves, possibly more waves ahead, and it's you know, I'm hesitant to make any predictions other than to just tell you that the current state is we're on a linear increase with no apparent mitigation. And it just speaks to what both Executive Summers and Dr. Sachdeva said, is that some of this is in our own hands, and widespread adoption of those prevention strategies are critical to bending that curve.
So Dr. Peters, have there been people pretending to be contact tracers and scamming people? And you also mentioned that the number of cases per 100,000 is almost equal to mid-March. What was the mid-March number? What are those levels again?
Sure. So I personally am not aware of any scam occurring to any of any of the cases or contacts in Snohomish County. That doesn't mean someone hasn't tried, but I'm just not aware of anything systematic. But I think nationwide, all kinds of scamming are up because, well, it's a time when that's happening. Take a look at your email inbox. And so we're just cautioning people more. This is more prophylactic information that if somebody's asking for your financial or information, that sort of thing, it's not us. Hang up, and if you think it might be us, go ahead and call back to the health district. The case rates in overall, much of this data that I'm describing and much more you can find on our case counts and data page off of the COVID-19 website at the snohd.org. But briefly, we spent about a sequence of about 3 weeks in a peak that was in the 90s and up to 130 and then down to 90. And then we had a sustained decline through the end of May, early June. So this is analogous to that. It's not as steep a rise, but the magnitude is comparable.
Thank you. Let's see. Another one for Dr. Spitters. You attributed the rise in cases among younger people to social gatherings, especially like July 4th. Any info on how much transmission was coming from outdoor gatherings versus indoors? And Dr. Sachdeva, if you have any information on that too, jump in after Dr. Spitters.
Yeah, we don't systematically collect that, and so I don't have an answer for you. We know conceptually that small is better than large, distance is better than close, and outdoors is better than indoor. There's more dilution of air as I breathe out, cough, what have you, and there's ultraviolet light as well that can inactivate the virus. So outdoors is better than indoors, but it's still, we want people maintaining social distance, gathering limits, face coverings, outdoors as well as indoors.
Yeah, I just want to echo that. And what we are seeing anecdotally, again, through our internal contact tracing, is that the transmission, again, this is anecdotal, and Chris, do jump in, is occurring when people are meeting non-family member, non-household members in small groups. Essentially, trust is a factor here. Like Chris invites me, I trust Chris. He's probably not doing anything silly, so I'll go meet up with Chris. And when I'm meeting up with Chris, because I trust him, I'm not masking, I'm not doing social distancing. So I think it's that kind of behavior where you're meeting up with trusted friends, trusted family members you haven't seen for some time. And from a human imperative, I certainly understand the need to connect. What I would like to share is, yes, we can connect, but making sure that we wear masks and we socially distance. When we do that, and against small groups outside is way, way better than small groups inside in a contained environment. It's the basic science behind transmission is the size of the inoculum, the amount of the inoculum, in other words, the amount of the virus exposure over time. So if the distance between individuals is small and it's over a prolonged time, I'm talking about 5, 10, 15 minutes, the longer you speak with that person, and if one of the individuals is infected, the more chance of the other person getting infected. If the inoculum is really small and the exposure is fleeting, like you were in contact with an individual for just 30 seconds, chances are that your immune system will be able to overwhelm the small amount of virus. So that's just the basic principles of science of transmission. And that's why masks and social distancing works so effectively, because it really impedes this basic mechanism of transmission. And so wearing masks, and social distance. I'll probably say that 100 times and it's never going to be enough, but this is what we need to do because it's really in our hands to stop this virus in its tracks. And the other thing I'd like to share is that we are staring at the flu season, right? I mean, and that's where every health system is now trying to plan what does this fall and winter season look like with flu just around the corner. And whatever mechanisms that impede the transmission of the COVID-19 virus also work equally well for the flu virus. So I think the important thing is that we are in it for the long haul. And if we continue these guidelines and compliance at a very high level through fall, winter, and early spring of 2021, we can beat this. And we can not only beat COVID-19, but the flu virus as well. And we can have a much better fall and winter season. The other thing from a healthcare perspective is that we certainly don't want to be in a situation where we have to stop our elective surgeries and procedures. That took a toll on everybody, and most importantly, our community members. So our goal is that we continue our normal operations in the hospital while looking after patients that may be coming in with COVID, which we're doing right now. But I think we anticipate an increase for fall and winter time, especially if there is poor compliance to these guidelines.
So the last question we'll address is, I hear from so many angry people who still think this is a hoax or related to the election, who say several weeks have passed since the beginning of the latest spike in cases and deaths, and hospitalizations still don't keep pace, young not getting super sick. Can any of you speak to these concerns? And also, if the only concern is that spread could move to older, vulnerable populations, why can't those people be under restrictions? And follow-up is, health is for anybody else monitoring possible adverse effects of the restrictions on things such as suicide attempts, domestic violence, and drug use. First, let me say, if people still think it's a hoax, that's really sad. You just need to go down to Swedish or Providence or talk to the families who've lost loved ones. COVID is a horrible way to die. And, you know, some people are just going to think what they're going to think. All we can do is keep putting out the best information we can. I know when I go out in public now, I see vast majority of people wearing masks, taking this seriously. And I think our citizens, our residents know this is real. It is real. And the vast majority are taking it seriously. So we're going to keep trying to put out the best information we can, urge people to do the right thing for themselves, for their families, for their neighbors, for our communities. You know, at some point you're not going to convince 100% of people. But Doctor, either of you or both of you, do you want to address that issue and also the issue about the vulnerable populations? Why can't we just put them under more restrictions?
Right. Well, although it's relatively confined to younger age groups, and so we're seeing continued low hospitalizations and not zero but low number of deaths, maybe 2 to 4 per week. You know, I think it's hard to contain that, even if you were to sort of cocoon the medically vulnerable and older age populations. But there's also, I think that I would argue on just a social basis that then impose, and most folks in older age groups and who have medical conditions are indeed doing their best to protect themselves. And that may be in part why we're seeing the age curve that we do now. But to impose restrictions on one set of age groups so that the other can have their way, I'm not sure that's the best community spirit that we want to show going forward. I'm not sure that's what's going to get us through. And I think a more collective interest is the way to go, and that we protect those around us by cocooning them, but also by doing what we can to prevent transmission, and whatever our age or health status is. And then just briefly to address that, you know, there are other health and mental health effects of this public health crisis and side effects of our response to it. The closing down activity has economic consequences, educational and mental health. And we've heard from law enforcement and social services that domestic violence and domestic problems are being reported more frequently. Our opioid overdose surveillance does show a slight increase over time over the past 6 months in opiate overdoses. I don't have data on suicides because of the way deaths get counted, coded, and analyzed. It's about a 1 to 2 year delay in counting deaths, but that's the view. And part of the response then has been and needs to continue to be addressing those side effects, either directly from the virus or from our response to the virus, to try to mitigate those personal health and mental health and economic side effects of this horrible thing that we're all going through.
Yeah, and I think Dr. Spitter's hit on all the points articulated very nicely. You know, when I look at the current demographics in terms of the age groups that are becoming positive or mostly showing positive results, my worry is that eventually this will reach the vulnerable segment of our population, may that be elderly or those with significant comorbidities or illnesses. So it's just a matter of time. So I think it's really important that these guidelines apply to each and every individual, no matter which group you belong to in terms of age, gender, activity, role. So it's again on us and making sure, again, I just love to say it again and again, that this is what we need to do. This is not a hoax. Like Executive Summers said, you just have to talk to somebody who's been hospitalized with COVID, or worse still, has lost a loved one to COVID. It's very real. Just like anything in medicine, every intervention, surgery, medication has a risk and benefits. Whatever we are trying to do to mitigate COVID transmission has risks and benefit, and you have to weigh them against each other. And the risk of not doing these basic, simple things like masking and social distancing far outweighs the risk of doing these well. Because like Dr. Spitters mentioned, the side effects of all these restrictions, so to speak, we can mitigate those effectively, like we have done by our focus on wellness right from the onset within Swedish, that yes, we are going into a crisis, it will take a toll on us, what can we do to mitigate it? I think I also worry about the economic consequences of not adhering to these simple behaviors. So that's huge, and I think if anything else, that should be an imperative for everybody. You know, gosh, if I just wear my mask every time I go and a social distance, we can keep our shops open, our businesses open, which is again so vital to the well-being of our society.
Thank you. And just one analogy on this last point is that it is like a wildfire. If you have a small fire, a couple small fires, they're fairly easy to control and put out, or as I say, control. But if you let this get going like a wildfire, pretty soon you lose control and you cannot put the genie back in the bottle. Really, it becomes extremely difficult, more and more difficult, and vulnerable people will be affected eventually. As we've already found out, we can't control everybody. People do have contact with vulnerable individuals, so it's a matter of time before this spreads. I have not seen any indication that the virus is somehow changing or becoming less lethal. It's just right at this point in time, really among the younger population, which fortunately do have lesser medical problems from it. But so there was a last question that we'll address. And we keep hearing about social gatherings being a leading cause of community spread, and continue to ask about whether there should be greater enforcement. At what point will you say it's actually time to start cracking down on these to prevent more spread? Well, you know, we are doing the best we can on cracking down on businesses and individuals. We're working with our state partners. I know the health district contacts both individuals and businesses. It's extremely difficult in our society to have the type of presence to really start doing strict law enforcement. I think if at some point it would take a joint decision by local governments, our law enforcement officers, our health providers, our public health agencies, and the state to do that. And we'll continue to consider those things. But how we would actually accomplish that widespread enforcement is difficult for me to envision. But Dr. Spitters, maybe as a public health official, if you'd like to address that.
Well, first, Executive Summers, I think you characterized the dilemma quite well. It's appealing, the notion of widespread enforcement, but the practicality of it and there are certainly good intentions behind that, but we also live in a social and political culture where that level of control over people is not something that we customarily exercise. So it really would be not just a legal intervention, but a culture and social shift that would, I agree, that would merit and require consensus among law enforcement, county government, public health, state government. And so we continue to plead and try to motivate people to do this in the sense of community spirit. And as Executive Summers said, I mean, that notion is on the table and we'll continue to consider it. But my hope as the health officer is that people will have enlightened self-interest for themselves and the community, think down the road, our best pathway to resuming public life, the economy, education, and all the other things that make up a normal life is to follow all this guidance. And that's my hope, is that we don't come to a situation where we're having to pursue enforcement like that, in that manner.
Hi, everyone. This is Carrie Bray in the Joint Information Center. I know we went over our usual time, but thank you so much to our speakers and to our guests for taking the time to listen and share this information. So I'll wrap up here quickly. Thank you again for joining us, and please do stay tuned for future media availabilities.